I've worked with my hands for decades, and one of the things is these tools are amazing, but we got to take good care of them. And as a manual therapist, there's all sorts of things we can do to take care of our tools. So tools for your tools, and hands have so much input to it. So there's a lot of things we got to do. For me, I've used a lot of techniques where I'm constantly gripping and twisting or pushing hard. Either from my days from being a college football player, I'm constantly grabbing weights and people. Your hands take a lot of beating. So one of the things I do throughout my week is use different tools to release, relax, and activate my hands. Sharpies are great. I like to take the blunt end of right here and put that in here. Very similar to the tie tool, but Sharpie is a great little move. I call this the Terrell Owens. Those of you remember him, use a Sharpie on the ball during the touchdown. But anyways, Sharpie is a good move on the hand as well. I'll get in here on the top of the thumb and push down as a pull up. And that feels really good through those as well. My favorite tools I use is a tie wooden tool. And what that looks like is this, usually about $6 on Amazon. And it's got different angles that I can get into it. So I'll get in my hand and you'll notice I'm gonna pin and then move my thumb around like that. I'll also twist it and get in between the fingers and pull down. And I like different heads for different reasons. Right there, and I'll just pull down as I'm tracking down. Now, this is a really tight little, it's called transverse ligament right here, and I like to pin that and just really open my hand and push on that. One of the good ways to use is a lacrosse ball as well. It's taking a ball and jamming that hand and twisting, and that's a really good way to open up that area here. Another great tool is these finger tools. Other thing I really like to do for fingers is, especially my thumb, is I'll take the mobility bands. This is not an exercise band, this is actually a compression band. They used to call it voodoo floss, but then they wanted to market to doctors, medical practitioners, so they turned the name to mobility band or compression band. So compression band therapy, I would take a strap of this and cut it in half so it looks like this. And then I would take that after I've been working out and then wrap around my thumb pretty tight. Not where my thumb turns purple, but a dark shade of pink would be all right. So I'm getting in there pretty tight, just like that. And then I'll just hold that down and move my thumb around in areas. Grip in here, really try to expand it, hold, and I'll take it through a range of motion. Right here, really try to expand it and go through different ranges of motion with that thumb. And I'll do that for about 90 seconds. The feeling you get if you've been in your shoes all day and socks, and you take that feeling, take those shoes and socks off, it feels fantastic. That's a lot like the compression band. You take that off, it just feels revitalized. You're recalibrating some of the tension on the tissue to the brain. You're also creating a little bit of a tourniquet, so you get a big burst of blood flow to the area, and that feels fantastic. Really good way to vitalize. The last way I get in is knuckles themselves. You have the tool. There's a joint capsule. Is a hyperbolt. I'll put it on the bone setting, and the capsule. Second. I usually use a prong with a thumb, and I'll get in, try to peel that capsule away, and push cavitation sometimes through the hand right there, just like that. And just take those. That's a nice way to get in there for the next knuckle. Now also, I'm elongating and peeling that away, and that feels fantastic as well. Enjoy. Another great tool is these finger tools, which you can see again, usually less than $10. There's a little piece here as well as here, and I like to work my fingers. Fingers take a beating as well, so I'll get in here and you can control the depth of pressure on the fingers on there. Be careful when you get the nail bed, you don't want to push too hard there, but great way to get into the fingers Love that there. And for the thumb as well. And on the back of it, again, rolling in there. It's good to get deep touch. It's good to get movement. And then use a roller like this to get light touch. You'll be amazed just from light touch through here, or just swiping with your fingers, how much benefit you can get from not always pushing deep down there. So